I've been doing this kind of work for years and years.
Yeah.
I started out teaching aerobics, like in the Jane Fonda days, we're the
Yeah.
same age. So, like before there was any real formal training, I was teaching at these big, like spas. Remember, they were
Yeah.
like
Oh,
health
yeah.
clubs and they had like huge classes, and I was up on the stage with like a
The
microphone
microphone. Yeah.
doing like high impact aerobics, like 5 classes a day when I was like 15, when I was in high school. I messed my body up so badly because they didn't know in those days. I was like jumping up and down on cement floors, basically. It was
Right.
like cement with a layer of carpet. So
Yes.
by the time
Yes.
I was 19, when I moved to New York, I, they didn't quite know what was wrong, but they was like, just take a break. Don't do any exercise. I was like an old lady. Like I would sit down in my car when I would stand up, like I could barely stand. My hips were in so much pain. And it
Yeah.
took
What's your
me a
back?
lot of work, my own healing journey to get out of that pain that then ended up helping other people.
You have to heal yourself, right? I mean, you
Absolutely.
have to heal yourself. The body has the ability to heal itself. No doubt about it. I've seen it in the hospital setting. In my background, of course, Denise, I'm traditional medicine trained, right? I'm pathology, anatomic and clinical
Oh, wow.
pathology. I come from traditional medicine. So what I see is a horror story, basically. I see the worst of the worst, right? As a pathologist, you see the specimens that come out of patients that are horrific, from end stage chronic diseases, which is what we're all trying to prevent now, right? We're doing preventative work so we don't end up in these bad end stage chronic diseases of hypertension, type 2 diabetes, metabolic syndrome, obesity, and everything else that wreaks havoc on your body. When I was hitting my 50s, things were changing and changing badly. Pre-diabetic, weight gain, snoring. And so this is a new thing. Now I'm snoring with the open mouth, dry mouth, the whole thing. I could tell teeth are shifting, problems galore. So I knew I had to correct this. What I wanted to do was start exercising. And that's what I did. I started to do some of these moves to exercise. And of course, I know some of this work that our speech and language pathologists do, stroke rehab, these types of things on our floors and neuro. And I've been with a lot of my mother's friends in their late years when they're admitted to the hospital. I'm with them. And so I've seen them, the challenges that they have orally with food intake and things like this. So long story short, I started doing the exercises. I was frustrated as heck because I said, I can get faster. I mean, I can get better. I can get stronger. I need to be stronger. I have to get my tongue stronger. I don't want to have dysphagia because I'm a risk factor for that with open mouth position, weak tongue, hanging low as you're breathing through your mouth. So anybody that's mouth breathing, obstructive sleep apnea, snoring, mouth breathing, whether asthma, whatever their etiology may be. And in kids, it's a lot of it is big adenoids or tonsils because of allergies for one reason or another. And that's a whole nother hours of that. Anyway, I wanted to get where I could get strong and get the muscles back in harmony and in balance where they needed to be. Strong lip seal, so you can close your lips without relying on mouth tape. We shouldn't have to use mouth tape in order to be able to sleep at night and breathe through the nose. So that's another thing that I've seen on the rise as a way to try to compensate for underlying etiologies that we can correct. And again, correct it with the proper nutrition, proper posture, proper exercise, being fit. And when I say fit, I mean fit head to toe. So I want to include fitness to be above the clavicle, not just below the clavicle. Check in with ourselves. How are we breathing? How do we breathe when we exercise? How do we breathe throughout the day? Are we using our nose? And all the reasons to use the nose, right? And there's a million of them, right? The big one is nitric oxide production, which helps with oxygen exchange, relaxation, the calming effect of breathing through the nose. So all of these things. So I was creating tools. I tried it with balloons, medical grade balloons that we use in the hospital to do all these different types of procedures, but it wasn't working. And so I had already trademarked the name. So I just left the name until I switched gears and figured out that the
I was
triangle
wondering
shape.
why they're called balloons. That makes sense now.
Exactly, because that's the hospital setting where we're using balloons, right? Like I said, for angioplasty to open up arteries, blocked arteries. We use them for sinuplasty. Our orthopedic surgeons will use them for kyphoplasty. We can use them to deliver chemotherapy or antibiotic therapy in small, hard to reach places inside the body. So there's so many interventional ways that we utilize medical grade balloons. And so,
Okay.
but it wasn't working in the oral cavity. And cylindrical shapes don't work in the oral cavity for what I wanted to do. And I was looking at a structure, it was a ceiling and it was supported, it was an arch. It was an arch and it was supported by triangles. And that's when it hit me, it dawned on me, okay, this is it. This is what will work because we have the palatal arch, the dental arch. We have anatomically two perpendicular arches that you're dealing with in the oral cavity. Stable geometric shapes, the arch, right? The Roman arches in architecture are one of our most stable geometric shapes, hence the arches. Triangles, same thing. That's why we see them in architecture and in human anatomy so much. When we learn our human anatomy, so many areas have boundaries that we define by triangles. So oddly enough, my tool ended up being a triangle and it just works great in and out around the mouth.
Have mine.
Denise, yes. Oh, great. Oh, you there? They do. Oh,
But
yes.
I've been doing it regularly,
Yes.
just a couple of them. So I would love to hear like
Yes.
which ones
Absolutely.
do you do? Which ones do you recommend? And I mean, I'm sure you recommend all the movements, but
Yes.
which are your favorite go-tos if you only have like 5 minutes at the end of the night after you brush your teeth and you just want to
Yep.
add this to your habit stack, your beauty
Yep.
balloons?
I went to the gym today and I was using it in the car today. So I do, I use them both. And you'll understand more. The more you understand the techniques and the more that you understand how you can manipulate and work them in and around the oral cavity, tucked into the gum area on the sides, tucked on under the gums on the front, in the oral cavity, protruding the tongue through the holes in the
I've
vertical
done that.
manner, sideways manner, right? The whole tools are used. Apex is used and base is used, and then the holes are used, mainly for the tongue, of course, the holes. Right. So these were some of the ones that I was doing in the car today. I always do my jaw. So that way I have no TMJ issues. I maintain a strong, stable joint in the temporal mandibular joint. No different than maintaining a strong, stable shoulder
Absolutely.
joint, a strong, stable hip joint. Why are we not working the muscles around the temporomandibular joint?
And
It's a joint.
I believe that you can actually
Mhm.
really help someone by them doing these exercises on their own. They can stay away from having to get TMJ treatment at the dentist's office.
No doubt about it. Absolutely. No doubt about it. If you straighten these things up, you get the muscles working in harmony and balance together. You're sleeping with your mouth closed, you're breathing through your nose, you have the proper posture. Absolutely.
And
You can
is
heal
there
yourself. Mhm.
another benefit that people might be more interested in? Wouldn't something like this and strengthening all these muscles around the neck and the jaw also help with
Lifting, exactly. And
lifting,
that is the whole thing, right? A lifting,
sagging,
right,
more
exactly.
sagging than
Wrinkles.
wrinkles?
Right, exactly. And what we're referring to, Denise, is shaping, contouring, and defining, getting more of our contours back like we had more in the youthful state. Absolutely, we can. No different than the body. It
Yeah.
is the same concepts, it is the same physiology. It's just the anatomy is a little different. The anatomy is just different up here. The muscles are a little bit smaller, but it is voluntary skeletal muscle. And when you stress voluntary skeletal muscle, and when I mean stress, I mean with resistance, just like we use resistant weight training,
Mhm.
we can use resistant weight training, if you will, because we're lifting. This is what we're doing. We're toning, we're lifting, and we're firming. But what I also love about this area is you're getting all the wonderful health benefits behind it. And this is, of course, my passion too, which I love, right? Having a traditional medicine background, all the important functions that we don't want to have compromised in the aging process. Loss of estrogen not only affects below the clavicle, loss of estrogen is wreaking havoc up in the head, neck, and oral cavity regions, which I don't hear enough people talking about. I
Right.
hear so much talking about below the clavicle, but we're leaving all of this out. The loss of estrogen and the changes that are occurring are impacting us tremendously in this area. And the big one is that women catch up to men in terms of snoring when they reach menopause. Snoring is dysfunctional. I was there. So many people that I know have progressed through that. They end up with dysphagia, they end up on CPAP, all the bad health sequelae, not to mention your risk for hypertension, type 2 diabetes, metabolic syndrome, obesity. Wake up strokes is another thing that's associated with dehydration because keep in mind with that open mouth position,
Right.
you're having incidental water losses. You have incidental water losses as we're sitting here now, right? We're
Of
evaporating
course.
fluids. But when you have your mouth open even more all night, 5,
That
6,
makes
7, 8
perfect
hours,
sense. I
you're
never thought about
dehydrating.
that. I
Your
never thought
oral
about that connection.
and your oral microbiome is changing. Your
That makes
oral microbiome changes. And when we swallow, guess what? That altered oral microbiome, where does it end up? Into the rest of our GI tract. So
And
this is
when you're breathing through the nose, you have little hairs in your nose that are actually protecting, and you don't have that in your mouth.
no,
So
all the functions,
there's no protection mechanism. I never
absolutely
thought about
not.
that.
All the benefits of nasal breathing, warms the
Right.
air, filters the air, humidifies the air. The mouth doesn't provide any of that, nor
Exactly.
the biggie is nitric oxide production. So we have to breathe through the nose. It is vital for immunity. You will have less head colds. I have less head colds. I haven't had a head cold in over a year because
Poo, poo, poo.
you know, I know that's my personal anecdotal experience and I love it. The other thing that also contributed to a smaller airway is retraction orthodontics in my youth. So in the late 70s, where they would use these types of mechanisms to straighten teeth,
Mm,
prevents the palatal growth. If your palate is able to grow to the full genetic potential, big, wide, broad, flat palate with forward facial growth, your craniofacial bones as you're growing as a child, you will grow a healthy, large airway. And that's what we want. We want to encourage that. Nowadays, we're shrinking, right? The bones are shrinking, shrinking, shrinking. And there's a million other reasons why that's also occurring, which is a huge another topic. I know this area and I know this area well. I have a child with cleft lip, cleft palate. I know what it is like to not have a palate. I know what it's like when you see someone struggling to breathe, kicking the sheets, having these types of struggles for air, gasping for air at night,
oh,
and the clenching and the grinding and all of this that so many people suffer with, which contributes to their painful TMJ. A lot of
right.
it's airway, a lot of it's airway. So if you get the muscles working well, you find out your etiology, but a lot of it can be habit, a lot of it can be retrained. Um, if you put in the effort and you take the time to learn about it, it's, education awareness is always a number one, right? You have to learn first.
So tell me,
Yeah.
how long have these been around? How long have you been using them? Because you were using them obviously before they were mass produced.
Right, exactly. With my prototypes, exactly trying a few different sizes and strengths on them, and they're compressible and bendable,
Yeah,
flexible.
I love the whole
Yes,
idea.
safe on the teeth, Denise, to protect our enamel, so we're not using things like pens or pencils
Right.
to try to get the resistance. We don't want to use any of those. I had a tooth, I had a little bit of chip because I was using barrettes as a child, as a young girl growing
Mm,
up. I would use barrettes, for our hair or ponytail holders,
yeah.
and it wears on the enamel. And people that bite their nails also, that wears down the enamel. So anybody who's a nail biter out there, don't stop because you're wearing down your teeth enamel as you're biting your nails.
Well,
Instead, use
maybe that will get my nephew to stop. I usually just
yeah,
leave
use a
him
grounding
alone.
tool. Use this instead. Use this instead as a grounding tool to help that. So this can
I
be
will
used
tell
for
him.
grounding,
Mhm.
anxiety as well, which I love, right? We see all those fidget devices too. Well, this is a
Yeah.
really great one, especially if you're a nervous driver in the car. I know for
Yeah.
me, sometimes this kind of really helps if I'm in crazy 8-lane traffic, you know,
Yeah.
this is also
Many
re-
uses. But so tell me,
relaxing.
so how long have
Yeah.
you been using the
So,
prototype? Like
so
from,
yep, for a little bit over a year, I would
okay.
say, and I would say that I continue to improve. I feel like I still continue to improve with
And
time.
can you tell me like, what have you noticed? Like,
Mhm.
what are some of the big things that have changed for you since you're using it?
Couple areas that I really were women, when you first start using them, you're going to see more of this lifted area here. What I say is the triangle of youth, more of
Yeah.
the triangle is going to be lifted. You're going to have less heaviness, less of the kind of that sagging jowl, which we
Yep,
call
I'm
that
getting it.
pyramid of age. So you
Yeah.
get more in there, and then the jawline. The jawline, you'll get more definition on the jawline because we're going to move the mandible in all different kinds of ways. You're going to bring back full range of motion of your temporomandibular joint. So we want to protrude the jaw goes side to side. We want to be able to open the jaw very wide. Very analogous to being able to move the shoulder in the full range of motion that the shoulder can move in, full range of motion that the hips can move in.
And it's all connected, by the
It's
way.
all
So
connected.
when
Yes.
you're opening this up, sometimes I know from just doing work in the mouth and in the inside of the mouth, you might get a hip release while you're doing this. And there's also, you were talking about the diaphragms. There's a diaphragm in the rib cage, there's a diaphragm in the pelvic floor. So it's definitely all connected, which is really cool. And the other thing that, strengthening the muscles with this is great, but I want to see if we can find some ways also to actually open the fascia,
100%.
and you're getting both of that strength and the release so that
Getting it
it's
space. Yep.
opening, and see if
Opening.
we can get, so I want to play with it, but show me. So show
Yes.
me some of the, like your favorites, like when you were in the car, like what are the
Yes.
things, if you only had 5 minutes, what would you do?
Mhm. Here.
So wait, which is that, the one or the two? The
Try to
one.
go like this. Uh-huh.
Uh-huh.
This helps with the lips. I'm going to
Okay.
show you some manipulation of the triangle in and around the mouth because I
Okay,
can do it
cool.
hands-free, Denise. I can do it hands-free. And you know what? What else are you going
That
to do in
takes
the car?
practice.
What else are you
Yeah.
going to do in the car? Now, New York, you're probably on the subway. So, you know
On the
what?
subway, nobody
Normal.
would look twice because
Yeah.
New York
You
is
see
so
somebody
weird. But I'm driving too, so I do, and
driving. Yeah.
traffic is
So, you
terrible.
know,
So I'm in the
like I
car for
say,
a
if
long
you're
time. I'm in the
you're
car.
sitting in car line, if you're a mom, you're sitting in car line, and these car lines can be 30 minutes at times. Trust me, I know, been there. So work out, right? Be productive with your time. So,
Okay.
so here you go. So, and you can use it. There's so many ways. There's over 50 different ways that you can manipulate the tools in and around the oral cavity, but we'll just show a few. Let me just show a few.
Okay.
So here, oh, here.
Okay. I haven't done
Mhm.
this
You can do that.
one.
Just say, oh.
Mm-hmm.
Yep. So you're strengthening the upper lip, right? Because as we age,
Uh-huh.
and what will contribute to the thinning, lengthening, flattening of the upper lip is the open mouth position.
Mm.
Lower lip needs to touch upper lip, you all. Lower lip supports upper lip. Lower lip has to touch upper lip.
So
This is
when you have
why
it in there, what were you do? Were you bringing your lips
say
together?
oh. What I
Oh,
like to tell people is you can say oh because that helps to build.
I
That's the
can't get it up
contraction.
there.
That's the contraction. And if you ever find that you're a little dry, you can always use a little bit of edible oil. You can always use a little bit of coconut oil to make it more slick if you want to. This is great on the gums for oral microbiome, bringing in blood supply. It's like a gum massage for
And
your gums. That's a double
also,
bonus.
and the big bonus also, these lines.
You got it. Yep. So oh,
Mm-hmm.
oh, oh. Oh no, it looks funny.
That's so funny.
And what you're doing exactly, Denise, is what you just mentioned. You're bringing in space. You're getting more space within the tissues, like you're talking about with the fascia, with loosening up the fascia. So you're working all of that. I
Okay.
know. Okay, so that's
And so
the
like,
O.
oh, so how many repetitions do you recommend?
Mhm.
Like,
So do it till you feel fatigued, right? Do it till you can kind of feel it. You can hold that for 15, 20 seconds. Now, when people first learn, this is what I see you all, weak muscles. So it'll flop around, and that's
yeah, of
okay because we want to be challenged. We want to be challenged, and you will
course, if you
strengthen.
don't, if you get it perfectly the
Yes,
first time,
it's
then
not exactly. You
you
don't
don't.
go to the gym in the weight room and know how to use all the equipment from day one. There is a learning curve. So here to
So I
there.
love that
Now what you
one.
can do is you can tuck it into the cheek here. So
I
we're
was
going to
pointing
put
that
it
out
into
this
the cheek.
morning.
And I always say rotate it in and out of the oral cavity very elegantly. So you
Okay.
grab the apex and it's just a simple rotation. So there's no struggling to get it in and out of the mouth. And then tuck it in the cheek. So just like that.
So sideways like that. So this is the,
Yep.
uh-huh.
And then you can blow the air. Use your hand to form the seal. And then you can suck it in
Mm-hmm.
and then blow.
Mm.
And when you suck, you'll have to kind of suck harder because you're sucking in against the resistance. And then when you inflate the cheek, it's more challenging because you've got the tool in there and you're having to really push harder.
I
And
love
so,
that.
exactly, right? So think about all the lymph fluid that's being moved when you're doing
Yeah,
that as well, as far as toning and firming the muscles. That's that jowling that none of us like. And so, and you're working your airway. So you're working your airway as
I
you
love
know,
that. I have
form your
to
seal. And then what you can do, Denise, now punch your tongue through the hole.
Mm.
So now punch your tongue through the hole as you've got it tucked in your cheek. And again, you can do all these in the car. These are all hands free. So tongue punch, strengthening the tongue, toning the cheek, working the jaw.
Mm.
And the hold. Tongue punch and hold for like 15 or 20 seconds, right? Challenging.
Okay.
then
Yeah.
then you take the tongue, once you have the tongue hooked in there, swing it around to the other side and do the
Swing
same
the
repeat.
thing around. Oh, that's That sounds like Cirque du Soleil in there.
Correct. It's on, yeah, exactly. It's a workout. It's a gym fitness. You know
So,
what I like in
so
the
try to
gym?
bring the whole thing over
Bring
to
the
the other
whole thing
side.
around. Watch how coordinated that I've gotten because I'm strong and
Okay.
I use the tool. So I'm very
Let me
strong.
see. Do that one.
Uh-huh.
That looks
So,
impossible. Hmm.
mhm.
I need help. Mm. Hmm. Oh, okay. I'm gonna have to practice that one. I
But
like
think
it.
about it.
That's
All these
great.
muscles, it's fantastic.
I'm so
All
glad you're showing me these because I've only been using this one.
and think about how hard it is for me to write that in a book, Denise. Like,
Yes.
you know what I mean? To see that motion. And this is why I love my live Zooms. And I see people who can barely do anything,
Uh-huh.
right? They're weak. It's normal. Loss of estrogen, you all, wreaks havoc on our strength, our muscles. We're just, and we don't chew like we should be chewing. We're not using this area like we should be. Um, but that's going to end if you use the beauty balloon. But
Yeah,
think
I
about,
love
I
it. Okay,
can't,
it just got easier doing it that time. Like after a couple times, it got
yeah,
easier. But I
exactly.
feel it, which is really nice.
Yes.
And it is
Yes.
strengthening, but it is also opening up that fascia
Yes.
because of the
Mhm.
way it's pushing.
Yes, exactly. Exactly. It's perfect for fascia, all of it. I know. So, and again, you when you're in here, you can manipulate it however you want. Sometimes I like to kind of push it back a little further if I want to engage the muscles back a little bit further. Because remember, you have two that run like this on this
Mhm.
lower cheek. Or if I want to bring it forward, and I can have it in any kind of manner. So people, depending on your oral cavity and your anatomy, just find out what you like. And then, like I said, you definitely want to swing it back
Yeah, I
and
really
forth,
like that.
tongue punch through each one, suck in the air, blow in the air. Now, if you have two, you can put two in there, right? You can do two,
Right.
right? And this is what I like. If you have a weaker side, you can focus more on your weaker side. That's why I
And I
really like.
definitely did. Like I was able to get it from this side back to this side much easier than I was this side to this side. Now, could you do, it wouldn't work with the two to try to do both sides with this
Yeah,
one.
right. Different things that we'll do with the two, right?
Right.
Different things, right? So this one is really great to get in the mouth, right? To get in the
Right.
cheek, get under the cheek.
Yeah.
This is because this is about the width of your finger, right? It's an 8 millimeter
Mhm.
diameter, right? And if people need to use their hand to form the seal, use your hand as you inhale and suck in the cheeks, right? And that's great to move that air. You move the air from one side to the other side, one side to the other side, particularly if you have two. If not, just swing it around and then use it
I'll
on
have to
this
get
side.
another one.
Mhm.
Mhm.
Again, and you can utilize apex base. So apex under the upper lip
I
or
like that one a
base
lot
or
too.
apex, right? And same thing with lower lip.
So you would do that same thing here.
Huh? Right now you're elongating the depressors, which is great, right? So we want to
And
stretch
so,
those depressors. So that's a good thing to do for there. Now, if you take the butterfly, hold it at the attachment site, and you're going
mhm.
to rotate it in and out of the mouth. Same thing. This is, I just want people, it's the rotation of the wrist
Uh-huh.
to get it in and out of the mouth. So no struggling. And now what we're going to do is we're going to use the tongue and tuck one base under the upper lip and one base under the lower lip
Mm.
as we
Ah,
bring it in. And
uh-huh.
so I'll show that again.
Oh.
But for now,
Mhm.
we're like this.
Oh,
Mhm,
what are you doing?
mhm.
Your tongue? Okay.
Lip seal. So now you're
Oh,
doing the lip
oh.
seal. So you've got one tucked in under the upper lip
Uh-huh.
and one
Uh-huh.
tucked in
Uh-huh.
under the lower lip and push it so it's really
Uh-huh.
going up against your nose and deep
Uh-huh.
down into the lower lip. Yep. And when you open your mouth even wider, push it in even wider. So think
Uh,
about this: jaw, lip strength seal, all of that you're working out. Then you say oh. You can just
mhm.
say oh and hold it as you do that. Denise, perfect. If you want to get super advanced, you can start to contract your cheek with that. So as you hold the O in the plank position, the lip plank position,
Oh, oh,
now you can contract
wow.
your cheek a little bit, and now you
Oh.
get a cheek pop. I call those cheek pops
Mhm.
with that. So you're multitasking. That's what I love about the tools, multitasking,
Wow,
working
that's
multiple
really
muscles.
challenging, but that
Huh?
feels
So,
so good. It feels so
mhm,
good. Love it.
So,
Oh, yeah.
girl, quick, and little.
That's great.
Isn't that great?
I
So lip
love that.
seal, cheeks, and range of motion of your temporomandibular joint.
Amazing.
All
That one, I really feel like it's
Mhm.
stretching the fascia from the inside
Absolutely.
because I do some stuff like with the finger, and this
Mhm.
is really
Right.
great. I love it. That's a really good one. I'll
Yes.
show you
So that,
the one that I've been doing is taking this in the teeth,
yeah.
yeah,
Yeah. Mhm.
and then the jaw
Yep. Love
forward.
it. I love that. And I do that in the car every day, Denise,
Mm-hmm.
every day. The jaw, the mandible, right? Because this is our mandible, the
Mm-hmm.
jaw jetting it forward is really what we want to work on. And the muscles that we're engaging are called the pterygoids. We have lateral and medial pterygoid muscles, but don't get worked out. When's the last time anybody ever jetted their jaw forward or side to
Right.
side, right? We don't do it, and we should be doing that.
I
So,
love it. I love the idea of doing that first and you're tightening and then
mhm,
doing the one that we just did for
mhm.
the opening because that's more, yeah. Go up.
So I go, so what I'll do for that setup, I'll go 1, 2, 3. So I'm straight. Then I just kind of just, like if I was going,
Are
oh,
you jetting the chin while
yes.
you're doing
Then
it?
when I look at the ceiling, jaw goes forward as I have the tool in the mouth. And with the muscles that I'm after, the muscles that I'm after here are our
Mm-hmm.
deep scaling, the little culprit muscles for the short
Mm-hmm.
neck, forward head tilt.
Mm-hmm.
These guys are bad news. The scaling muscles are bad news there. And
Mm-hmm.
so that's who I'm going for here. So 1, 2, 3.
Mm-hmm. And while you're,
1,
And
2.
so while you're in there, what I would do as a fashion person is
Mhm,
while you're in there,
mhm.
just kind of lengthening
Yes,
here as you're pushing the
yes,
jaw, and then you're going to get a really even a nicer release. It's going to
absolutely,
come down in here, or even just working around the clavicle as you're doing
absolutely.
the jaw jet. It's amazing. I love
And
it.
I
It's
do
so
those, and,
simple.
and exactly what you're doing, I'll do that too. I need my hands for that, when
Yeah,
I'm doing that,
right.
So,
You can't do that while you're driving. We
yeah,
shouldn't be
right.
looking over there when you're driving anyway.
Right, exactly, exactly. I know. And we laugh, right? We laugh because we do look funny, you all, but this is just a quirky
Yes.
anatomy that you have to work around up in here. And that's okay. That's what I said. Who cares? This is about your
Yeah, I
health,
did a video of just
you
like
know?
taking the tongue around the inside of the mouth to open up the fascia. And
Yeah.
my daughter called me. She's like, Mother, you have to take that video down. That is porn. And I'm like, oh, stop.
Yeah, yeah,
It's really
right. I know,
important.
right? Around the world, right? A lot of our
Yeah.
myofunctional therapists that use that, right? Exactly.
Yeah.
Think about that tongue strength. It's the same thing with tongue punch. Tongue
Yeah.
punch, and you can go all corners, right? Go up, down. Tongue punch as you're punching through. All of that
This
to
is
hit the
so
tongue.
important to strengthen that, to strengthen the tongue.
Absolutely. To build symmetry, strength. I love the jet forward jaw side to side as well, because now you're gauging the temporalis muscle in a symmetrical manner. For those that want aesthetics, this is the way to keep the weight of the face north, and you get like a
Absolutely.
little bit of a, eyebrow lift, if you will, because you're not going to have that temporal wasting. You can really feel your temporalis muscle as you move the jaw side to side on that movement. And so it's just simple. And you can use either one, Denise, whatever people are more comfortable with. If they want 2 contact points, use the
Mm-hmm.
apex of the triangle. Or if they want 4, like what you and I are doing with the 4, it stabilizes the jaw. It trains the muscle symmetrically, consistently, and so you're in balance. So every time we open our jaw, we're all a little bit lopsided. And so I
Mm-hmm.
like to have this tool because it keeps the jaw in the same plane.
Ah, love
So you
that.
can use 2 contact points or 4.
It's not easy.
Uh-uh. Uh-uh. And now feel here, right
Mm-hmm.
here. Mm-hmm. Mm-hmm.
Mm.
Mm-hmm. Right here. Yep. So
Yeah.
that'll really help with bringing back more symmetry. Again, you're training the muscles consistently, symmetrically, and you're adding in some resistance because you've got that tool in your
I
teeth,
love it.
and you're
You can
holding it
also,
stable.
another thing I was just thinking of is you can, if
Yeah,
you take your fingers up here, like while you're doing the jaw and just help to support that lift and also potentially working on the little line.
absolutely.
Not that I do the
Absolutely.
facelift
All of it,
stuff, but
all of
it's
it
all great
with
if
your
you,
hand. Right. And I'll even do the masseter massages when I have the tool in my mouth like this too. So like this, right, with oil.
Mm-hmm.
or I'll get my master's. What?
The other one that I was thinking of when you were doing this one is
Mhm,
I put in and then use the other hand to kind
mhm,
of stretch it,
mhm.
and pull it back even
100%.
further.
Yep. 100%. Yep. Exactly.
And it gets in there because people have a hard time getting, I do a lot of stuff like going the finger
Yep.
and way back, but this actually gets right back there and it's painful. People don't realize how tight they are in there.
Oh, absolutely. This is why I like these large range of motion, big movements of opening the jaw. Just like I want to, I want to have these big range of motion of your shoulder. A lot of people as
Absolutely.
we age, you can't, they barely can do this. We want to really work and keep our full range of motion and mobility of our joints. And this is a joint. We should be doing that. And so yeah, let me show you. There's so many, like I said, there's
I
so
know there's
many,
so many.
so
So
many, Denise. There's so many.
yes,
Um,
it's unlimited
no, it is.
because
It's
there could be
unlimited.
more and
It's
more. Yeah.
unlimited. That's, I mean, it's like, it's overwhelming.
I think of the
Mhm,
what we've done, what you've just given us, have like that is a great way to start. Okay, what's
mhm.
that one?
Symmetrical chewing. I have the base kind of behind my canines on my premolars. And whenever I
Okay.
have the tool in my mouth, I always keep my tongue up on the palate as a
Okay.
reminder, lightly suction, just as a good reminder. So you train yourself so you know where your tongue is at all times. It's a good, I want people to kind of think like that. And then I
Mm-hmm.
just symmetrically chew in a V-like motion. So again, temporalis, upper cheeks, just a good healthy chewing, stimulating the bone, right? The alveolar bone that holds our teeth. So that bone stays nice and strong. That's why I like this too, to do this, because
Mm-hmm.
I'm stimulating that forward bone there on my front incisors. And remember, we have bone loss, right?
Yeah.
Estrogen, we have bone loss. We lose the bone in our jaws, the mandible and
And
the
you notice
maxillary
as people
bone.
age, you see how their faces start to
Mhm,
sink in.
mhm. And so if you're chewing and you're stimulating that bone, you'll help remodel the bone. No
Right.
different than the spine. That's why we want to do weight bearing exercises for women so we don't lose the thickness in our vertebrae. Over time, this is what our women's vertebrae do. Do, do,
Yeah.
do,
Yeah.
do, right? So if you think you're getting shorter, you are, because you're losing, the bones are remodeling and your vertebrae are doing this. So you want to stimulate your bone. And that's why we go to the gym to stimulate the bone. Same thing up here. We can stimulate bone up here. And this is a way to do it. So that, and it's simple. Look at how easy
Yeah.
that
This
is.
one's simple. Uh-huh.
I know, right?
And what was
Tape
the
on
other
the
one that
teeth.
you did when you put it all the way in? Did you just have it this way when you
Yes.
put it all the way in?
Yep. For this, I just have the apex and I have 2 contact points on my incisors.
Mm-hmm.
See that?
Mm-hmm.
Just on the front.
Oh, that's that one. But then you put it in your mouth and you did,
If I'm going to chew, then I can use the base.
and you put the,
Hmm.
Mm.
Hmm. Another
Okay.
one that I really love too is the fanning of the lips.
That's taking it this way.
Hmm.
Mm-hmm.
Yep. Yep. And I just, like I said, I'll kind of put it in and yep. So I
On
call
that
that the
O.
straddle position. Yep. And you can kind
Uh-huh.
of find your comfort zone if you want to push it a little forward or pull it back, however what your comfort zone is on there. And then you want to fan. Yep. They look like fish lips, right? Fish
Uh-huh.
lips. But think about what you're doing.
Uh-huh.
Symmetrically training the orbicularis oris, the superficial fibers, all the lippy version muscles. You're symmetrically training them because the way that we eat, the way that we chew, the way that we speak, the way that we sleep, we're all getting asymmetric, right? Everything's asymmetric, right? So this helps to bring back more symmetry, balance, harmony to our muscles, right? So we don't have what we call that dynamic muscle discord, particularly in the perioral region, which is where we get it. Yep, that one. Hold for 5 seconds on each side. Exactly.
Uh-huh.
Yes, I love that one. One of my favorites, the 2-step. Yep, if you just hold, yep, hold for 10. 1, 2, 3. Yep, and you're using resistance, right? Do you love
Uh-huh.
that? I know. The
Uh-huh.
lateralization. I know. I know. Tell me
Love
about it.
hate. I don't I like it because
Yeah.
I know it's good, but it's
Uh-huh.
not easy.
No, it's not. These are not easy. These are not easy. And that's the 2-step, but very unique to the tool, right? Think about
Yeah, for
that for
sure. Because you
resistance.
can't do it like you don't get it
Right.
the same with a
Right.
different
Like
area.
I said, I'll see people do it, but it's not the same.
No, it's
It's
the
not the
same.
same. And then I love the tongue row where I really want to see the attachment site come all the way in the oral cavity. I kind of will put my head back a little bit and I just lightly hold it so it can rotate because it's
Mhm.
round. Since it's round, it can really rotate like this. So I really want the tool to rotate loosely. So this is what I'll do. So I'll press it on below my lower lip.
Uh-huh. And for ladies, if you're single, and you demonstrate this, I'm sure that you get results.
Yeah, I know. Right, I know. Believe me, my urology colleagues can talk all they want on this one. But what I love about this is airway. This is really getting the back of the tongue, getting that airway, getting the palatopharyngeal muscles. Because with snoring, remember, a lot of it is vibratory noise, right? As you have turbulent airflow against some of the tissues back there that are not firm and tone as they should be. This is a way to get into those deeper back throat muscles. And it's really important to do that so we don't go down these bad pathways. Dysphagia, and aspiration risk in the hospital is what keeps patients on our floors. You can't
Wow.
be discharged if you can't eat and you can't swallow safely. If you're
Right.
at risk for aspiration, you're not going to get out of the hospital. So don't even let yourself get there. This is so easy to do. And I'm at risk. So like I said, I'm at risk because mouth breathing, weak tongue with allergy. So like I said, I've corrected all that and I've done it with
So
good
you
old
notice it,
fashioned.
so you are not snoring anymore,
No,
and
I
you're
sleep
able
and
to.
I can sleep. Not only that, I can sleep upright, full mouth closed like this on an airplane. And when I drive to Orlando, if I have a pillow up against the door, if my husband's driving, before when we would go, I'd wake up, open mouth,
Yeah,
dry, where's the water? Where's my water? Now I sleep like
I
this.
love that. And I can tell just like from what we've just done right now, my breath feels fuller. I'm feeling it more in the back of the
Yes.
throat. And that's just from these few minutes.
Right, right. And
So
we,
I
right.
would say a
I know.
great thing for people, this is something that is a great habit stacker. I,
Yeah.
I see
Mhm.
people taking their favorites once they learn them and doing 3 a night before bed.
Yes,
And as
exactly.
long as you do something,
Do
I think it
something.
can be super beneficial.
And
And
that's the key. Every day. I want something done every day is what I recommend. This should be part of our normal lifestyle exercise because we're becoming a global world of mouth breathers. I think I read 60%. I think it's even higher than that are mouth breathing, either pretty much full time or even partially,
Mhm.
going back and forth from mouth breathing to nasal breathing. But if you're on that pathway, you're headed for a bad health
Right.
sequelae.
No, this is great preventative
So
stuff.
mhm.
And I'm gonna play with it and come up with some more fascia things
Yes,
to
I can't wait,
do.
Denise. That is so fun. I know all of the great fascia. Oh my gosh. And this for mhm,
Yeah. Yeah, that was a hard one for me. I gotta practice that one.
yeah. It'll flop, it'll
That's
fall.
like behind, that was behind the teeth,
Yep, that's
right?
behind the lower teeth. Yep. And so I say people just hold that position first, big and wide. So actually it's like this. And you don't want the base to touch the upper teeth or the upper lip. So you just hold
Oh.
that pose. Hold the pose. Uh-huh.
My mouth doesn't go that way.
Uh-huh.
Um,
Uh-huh. You'll get it. And you just tuck
ah,
the tongue. You
that's a hard one for
touch
me.
the tongue to behind the lower teeth. Totally normal. These are actually advanced. These are super advanced. When
Oh,
I first teach people, very weak, flops out of the mouth,
yeah, that's hard for me.
totally normal, flops out of the mouth, and then I'll see them in another month, and they're
Yeah, that's amazing. That's great. Yeah, I gotta practice that one. That is a tough one. Super impressive, really.
that is very
It's like
tough.
Cirque du Soleil
That is super advanced. Think about it. Jaw, you're really, really opening your jaw as wide as you can for that one to
Right,
not let the base, and you're not compensating with any other muscles, right? There's no cheek or lip because you don't want to do this.
right,
That's compensating. This is strictly a tongue. This is
right.
strictly using the tongue.
And the
But what
tongue is really important.
But what you're getting is floor of the mouth. How else are you going to get to the floor of the mouth, the double chin area? Floor of the
Right.
mouth, floor of the mouth, floor of the mouth, wide range of motion of the jaw, isolating the tongue. And then you can use the K sound like kick or the G for Gary to really work the posterior third of the tongue to have it really up on that soft palate in the back.
Yeah.
Again, fantastic for airway health, preventing dysphagia, any of these other types of issues that people can have with oromotor dysfunction from illness or injury, whether, stroke rehab, Bell's palsy, multiple sclerosis. I've had a lot of people reach out to me that are making great strides by doing these types of
Wow.
movements. I had
Parkinson's.
Parkinson's, absolutely Parkinson's, all of this, all of this.
Any kind
Simple.
of neurological thing, I think it will be really helpful.
Absolutely. Grounding, grounding, you get that sensory, tactile stimulation. Exactly, Denise, all of
Yeah,
it.
there's a lot of benefits. I love it.
I love your fascia niche, and because this is a perfect complement to what you're doing and can go to the next level with it. Yes, so Denise 10, so we can do a Denise 10.
Okay.
And then they just would need to purchase through your link, and the link will automatically apply that percentage off.
I'll put it in my link tree. I knew it was good, and that's why I wanted
Exactly,
to
Denise,
talk to you.
exactly. Those in the know get it out. People who are new to oromotor, who don't understand fascia, right? Of course, me being a pathologist, I've touched fascia, right? I've had
Right.
bloody gloves in fascia, right? In
Yeah.
muscle, right? When I've dug in to get the arteries out of the legs, all the clear, I call it shrink wrap. It's like a shrink wrap
Yeah.
covering is really what it is. Like at Christmas time when you go and you put the hot blower and it shrink wraps on it.
Yeah.
That's really what fascia is, and you can
I
peel it and it's
know.
clear and it's see-through. It's a glistening covering that encases everything. It's all connected. It's like a thin, clear shrink wrap that you can actually peel, and it adheses and it gets stuck and it gets tight. So you have the adhesions, and it's the same thing in the mouth. So I
Yeah.
love how this loosens up all the fascia in the oral cavity because it can get tight. And that's why I like it as a gum massage too, to work it around in here.
Absolutely.
It's
But the other
all
really cool thing about the
great.
fascia is that it
Great.
communicates. So
Yes.
you might have, the other part that, and we can save this for another conversation, but are the emotions that might be stuck in this area, specifically
100%.
trauma, childhood trauma. If someone was punched in the face, if someone had an
100%.
accident, if someone had like this stuff can hold on. The fascia holds all these things. So as you're opening it and as you're doing all of these movements, you might have some emotions come up, and that's okay. It's good.
100%. And scar, right? It's scarring. It'll hold the scar because what you're talking about is holding the scar is what you're
Yeah.
doing, where it's been disrupted in one way or another from whatever the issue, whether it's infection, some kind of illness or whatever, like you said, trauma, right? Some kind of injury, illness,
Right.
whatever,
And
whatever
it
the
could be if you
insult.
had your adenoids out, if you had, if you had your tonsils out, if you had some kind of oral surgery that was traumatic, like all of that stuff is all stuck around.
Tight, yes, tight, and it can scar, right? It scars and it rubs and it sticks. It adheses to each other. And this is all preventative. This is what we're doing.
Yeah, it's
Preventative,
all
right? We're all doing
preventative and it
preventative
goes,
work.
it's so
All of it.
specific.
Like I said, I have zero TMJ. I used to have a little bit over here on the right. I have zero, zero. And
That's
look at the
amazing.
movements that I'm doing with my jaw, right?
I know,
Big,
super
wide,
impressive.
side to side, up, down, head back, side to side. Look at the range of motion that I am doing. And like I said, we're 58 and a half. Okay.
Yeah,
So, this is a great thing. Like we're setting ourselves up. So this is just part of it. If I can contribute to improving people's health, then I feel like I've done my job. I've done my
absolutely.
job,
I think it's great.
which I'm
And
thrilled about. And
I've just
so fun.
chosen like the three that I've been doing, and every night I try to do a few more. And
Yep.
like I started with 50 and now I think but I love that you said do it until you fatigue. Like
Yep.
I'm doing this one.
Uh-huh. Uh-huh. Yep. And then, like you said,
Right.
extend back.
I wasn't like, I learned from you just that. I wasn't
Yeah.
doing the ankles, but I
Extend,
will
yep,
now.
extend the head and
Uh-huh.
you
And
go
I'll
oblique, a
do
little
it.
bit oblique, and that way you get these deep scalene muscles that
Uh-huh.
are called, yep, from the deep cervical vertebrae to the upper part of the ribs. And those are the muscles that you use
Mm-hmm.
when you mouth breathe. You use different muscles, mouth breathing, than the musculature that's used when we nasal breathe. So these scalenes get
Yeah.
really tight and really short, and we don't want that. We want to really loosen them up.
I
So
love
that's
that.
just a great.
These and
Mhm.
yeah, and
Yep.
I do some releasing here in my
Yes.
pelvis for the SEM.
Yes, all that fascia release, exactly, and doing that, the tongue hitting the frenulum,
Yeah,
right?
so I've been doing the
Right,
tongue, but
the
not holding it
two-step.
long enough, so I need to do that, and then
Mhm.
the other one that I was
Trampoline.
doing, which I think is not exactly right, is I was just putting it in,
Okay. Oh. Mhm. Mhm. Mhm.
but I wasn't putting it in the top and bottom, I was just putting it in the mouth, like,
Mhm. And
oh,
you can do it both ways, exactly, and he's right. So that
but
you
I
can do
liked it
both.
much, it was much deeper when you
Yeah,
did it.
so lip,
Mhm.
right, and then for the other one where you just kind of, again, rotate it in and out, right? Rotate.
Uh-huh,
It's a light tap. Like whenever they're in, you're never really a hard bite. It's just a
right,
light tap because it keeps the jaw in a symmetric plane, so you're not lopsided. So it adds
right.
stability for the jaw. So we train the muscles symmetrically and in the same manner. So
Yeah.
for this one, I can do the lip plank, I can do the lip extension and the cheek pop.
Yeah. Wait, do you have it? You don't have it up in the top. You just have it straight
Just
in.
lightly biting. So lightly bite, and I kind of can pull it forward however far that I want.
Mm-hmm.
And then I can hold the sides with my index and thumb. I can hold the sides of my lips.
Mm-hmm.
hmm
Mm-hmm.
hmm hmm Exactly. So you've got something to grip with your index
Mm-hmm.
and thumb, the sides of your lips, to give you a pretty pout. And
Like
then it
Donald
helps.
Duck.
Yeah. So speech, articulation, all of it, right? It's all right to bring back lip strength, right?
Very
And
cool.
articulation, right? And so women will love the way their lipstick goes on and their lip liner and all this comes back to
Yeah, and I think it'll help with all the
firm.
little wrinkly stuff up here that
Mhm.
people
As
get
the
at our
Yeah,
age.
right. As the muscles become more firm, more tone again.
Yeah.
Yeah, I know
Yeah,
it's all
I
good.
love it. I love it.
All
Okay, well
good.
the
So fun.
the things we can do with it are really endless, and I'm so
I
excited that
know.
we had this conversation, and I'm excited to play with it and do some videos for you and share it because I think it is such a great preventative tool. It's such a great prevention tool for so many things.
Thank you. It is. Thank you, Denise. Thank you. I know. It's so fun. So fun. So yeah, sounds
Okay.
good. Okay.
Bye.
Talk to you later.
Bye.
Bye, Denise. So great to meet you.
Yes, ditto. Bye.